people have asked also another question. It's been interesting that our season 1, because you find a lot of questions that people has been asking constantly. We have some topics that we're going to talk about. But talking about today, what are the signs and symptoms that we're going to need for decay, for caries? What is decay, or what is caries? Remember, in the season 1, I have an episode about decay also. But I want you to know that you're not going to have any pain with this. It's not, the only sign is that if you have a little brush, a little mirror that you find in the pharmacy, and then you will go in your mouth and take a look, and then you see a little dot of this size. So when you look at the dot, then you see, wow, it's big, right? Now, you cannot see this one right away, because even you will have to put the mirror all the way back to your mouth, and maybe you don't even know, because then with the saliva and the breathing is gonna be opaque, the mirror. So what do we do with this? Most likely when you floss, that's very important. Even if you floss with this, somewhere the floss here is gonna get stuck with the decay. Why? Because look, it's exactly what happened in our mouth. So what we do is we're flossing, and in the little hookup that you have here for the decay, see, this is gonna be, and then you said, oh, something is hooking up my floss. Why? Maybe I didn't do it correctly. No, my dear, what is happening is that is a sign that you have a small caries. Go to your dentist immediately. It's as of today, you haven't been in the dentist, because many people during the pandemic didn't go. Run to the dentist and try to find out. Trust me, you're gonna save a lot of money if you go to the dentist, and the caries that are starting, either you control it with a very good technique that I gave in episode 3 of the season 1, otherwise it's gonna continue, get bigger and get bigger. And guess what? Once it's bigger, as I said before, this is gonna be close to the nerve, and what is gonna happen with the tooth is gonna be the caries close to the nerve. And when it's close to the nerve, then you have to do a root canal, just like we have here in this one. In this one that I have shown it several times. But now take a look at what I'm gonna tell you now in our screen. So in the screen you will see, well, you're gonna say, well, it's a root canal in a regular tooth, but in reality, look at the complexity of the tooth. And once you don't take care of the tooth, several things can happen. It's not only, oh, how do I find if I have caries? But if you don't find out, then the caries is gonna continue, and then what is gonna happen is it's gonna continue, and then you're gonna have a need of a root canal. Or better yet, if you have a crown before and you were grinding, or you're not flossing correctly the way I teach in the season 1, episode 3 for adults or 2 for kids, what is gonna happen is you're gonna have a big abscess. Of course, this was a 55-year-old man, but I've seen this also in a 20-year-old person, where you open the tooth and remove whatever was there, and all this green pus is gonna come out. So you're gonna see how this drainage, and you can avoid how, knowing how are you gonna know if you have a caries. Sometimes you can have a bad smell of that. So you go to your dentist, and they're gonna give you enough time to do your diagnosis, check your medical history, have x-rays, and you're gonna avoid several things. We're gonna have in the future a topic about refer pain, where if you don't take care, for example, of this type of infection, you will get into a septic shock if you don't take antibiotics, and by the time sometimes you get to the hospital, the patient die. Not many people know about it, because in the hospital they don't announce that, but it's better to avoid. Your signs of symptoms of the decay are minimal until it's very late, so don't wait until it's late. Follow us in our YouTube channel. I hope you have enjoyed this information. Remember, if you have signs and symptoms, you want to avoid this, because you're going to save money in the cleaning, in the endodontist, and in any other part of your health. You can follow us on Instagram and follow us on TikTok. Thank you.